Okay, I wish to welcome everyone to this meeting of the Health Occupations and Long-Term Care Subcommittee of the Health and Government Operations Committee. We are meeting to discuss several bills, both House and Senate bills that are before us. What we're going to do first is take up
turn off this one.
This
is the one that
we have four sunset bills, which council will explain are all have the same sunset provision at the request of the Department of Health. Council, can you explain what these bills do, and then we'll take each one individually.
Okay, so Senate Bill 726, 727, 728, and 731 would extend all of those four boards, which is the Board of Examiners of Psychologists, Board of Physical Therapy Examiners, Board of Examiners in Optometry, and Board of Certification of Residential Child Care Program Professionals, and they would extend them to July 1st, 2025.
And was I correct in saying that says introduced, and that is at the request of the department?
I think they were amended in the Senate, but this is at the request of the department that the secretary would like to study all of the health occupations boards, is my understanding.
And there is no cross-file, because on bills of this nature, there is no cross-file.
Correct.
Okay. And is there someone here from the department who wishes to speak on behalf of the amendment that has been adopted by the Senate to
Hi.
Ms. Peters?
Yes, this is Megan.
You are
Peters.
recognized. Sure.
Thank you. My name is Megan Peters, Acting Director of Gov Affairs for the Department of Health. Like you mentioned, Delegate, these amendments were at the request of the department to amend the sunsets for 2 years, because we believe this will allow us ample time to kind of look at all the boards across the plate and come back with an assessment and to the General Assembly in 2 years with an update.
I can reach back out to the.
Could I ask that those of you who are talking, mute yourselves? Thank you. Okay. Are you done, Ms. Peters?
Is that we
Yes.
not,
Okay. Is there any questions or debate from the members of the subcommittee, or is there anyone from the public who wishes to speak to any one of these four bills? I see no hands or indication of anyone who wishes to speak on these bills. Therefore, I will accept a motion on Senate Bill 726.
So moved.
Second.
Motion is for favorable on 726. All those in favor say aye.
Aye.
All those opposed say nay. No opposition. 726 receives a unanimous favorable. Is there a motion on 727 physical therapy examiners?
Move Senate
So
Bill
moved.
727.
It is moved and seconded for favorable. All those in favor, please say aye.
Aye.
Anyone opposed? Seeing no hands or no voices, that too is unanimous. 728, examiners in optometry. Is there a motion?
Move Senate Bill 728.
Second.
Seconded, motion then moved and seconded. All those in favor of a favorable, say aye.
Aye.
Anyone opposed? Okay, thank you very much. Final sunset bill 731, residential child care program professionals. Motion?
Move Senate Bill 731.
Second.
And there is a second. All those in favor say aye.
Aye.
Anyone opposed? It is unanimous. Okay. Now let's go back to the top of the list to House Bill 786, electronic health networks, and we'll take that up. And just as noticed, Senate Bill 648 is the cross file. Okay, Council, can you explain this bill?
House Bill 786 authorizes a nursing home that contracts with or uses an electronic health network or electronic medical record vendor to direct the vendor to release patient medical records or electronic healthcare transactions to a business associate of the nursing home. The bill includes requirements for electronic health networks or electronic medical record vendors to release this information. We discussed this a week or two ago at this point, I think, and the Senate had adopted amendments that clarified that the release of the records and the transaction is permitted with the consent of the patient or the patient's personal representative as required by HIPAA, and also prohibited the charging of a fee to a business associate contracted with the state designated health information exchange unless the fee was approved by the exchange. We did not take action on those amendments or this bill or the House bill. So we now have both the House and the Senate. At the Senate hearing last week, Senator Rosapep, he has offered an amendment that would strip the amendments that the Senate put on. So that's where we are with these two bills now.
I'm sorry, who was offered that amendment?
Senator Rosapep.
Oh, he's now asking us to
Strip
that.
the Senate amendments.
Okay. We also have, and it was distributed, understood that it was done within the last half hour. We did request, as a result of the last meeting of the subcommittee, we requested an advice of counsel from the Attorney General as to whether the action, or whether this legislation was preempted by federal law. And the answer to that is no, according to our Attorney General. This bill is not preempted, so we do have the authority per that letter to take action with this legislation. And then we also have a letter from the Healthcare Commission. Is there someone here to speak from the Healthcare Commission who can speak directly to the position that the commission took? Is there anyone, counsel?
Tracy is here. Tracy
Ben, do you want to
DeShields.
respond? Hi.
Yes, please. I'm sorry. Tracy DeShields. My fault.
That's okay. Hi, this is Tracy DeShields. I'm with the Maryland Healthcare Commission. So we oppose the amendments because, one, they were in conflict, well, especially the fee position was in conflict with current law that was passed in 2021. And advice of counsel seems to concur with that. We also had issues with the issue around consent, because under HIPAA, there are certain permissions that are given that do not require patient consent to release certain information. And so this would be in the requirement for the nursing home information to be released to the state designated health information exchange is consistent under HIPAA currently. And we just are seeing amendments that are being posited by, and I can't, Neil, I can't pronounce your last name, Neil, but we're trying to look at that. I don't know that we would concur with those amendments.
Okay. When did you receive those amendments? Or you just saw them today?
Probably, yeah, just 5 minutes ago.
Delegate Rosenberg, they were sent to me after you left my office. So they are very new.
Okay. Well, I know when that was.
They have not been offered by any of the delegates at this point, but it was just kind of an FYI that I sent it on to Tracy.
Okay. Delegate Cullison.
Thank you, Mr. Chair. I would just, with your indulgence, ask Tracy to make sure I'm understanding. So what you're saying is MHCC could support the bill as originally written, but if the amendments from the Senate that Senator Rosapep has requested are now withdrawn as he has requested. Am I correct?
Yes. We
in
would
that?
be we're in support of the bill as it was originally introduced without any amendments. And we would be fine if the Senate bill goes back to the posture that the House bill is currently in.
Thank you. Thank
That
you,
makes
Mr. Chair.
sense?
Yes. Just to be sure for all the members and the public, what the Healthcare Commission, as requested in response to the inquiry from Delegate Cullison, is they would support the bill as introduced, which would mean the House bill unamended and the Senate bill with our taking action to strip from that bill the amendments that were added to the bill by the Senate. And that is a position with which the Senate sponsor concurs.
Mhm.
Is there anyone who wishes to speak to the bill? Mr. Karkanis, if I'm saying that correctly.
Hi, Chairman Rosenberg. Neil Karkanis here.
Sorry.
On behalf, no, you're good. We're getting closer from last week, actually, so I appreciate it. So good afternoon, Mr. Chairman, members of the subcommittee. My name is Neil Karkanis here today on behalf of my client, Point Click Care. Just a little bit of background. Point Click Care is a cloud-based healthcare software provider. They help long-term care and post-acute care providers navigate value-based healthcare, which is what we're here to talk about today. So thank you again for the opportunity. I do want to start by saying thank you to the chairman for requesting the AG's opinion on Point Click Care's concern that the bill may be in conflict with the federal rule that permits charging a reasonable fee. We understand the AG's opinion to read that the federal rule that permits those fees does not grant a right to charge those fees. And therefore, like the chairman says, you're not preempted. The state may choose to ban fees. As a result, this is a public policy question for this subcommittee and the committee. But we do respectfully submit that an outright prohibition of reasonable fees does run counter to the goals of the Cures Act, which was to spur innovation in the healthcare information technology space. So that being said, we did submit a couple of amendments this morning. I did speak to the proponents early this morning and did speak to the bill sponsor in the House. I do want to apologize to Lisa. I did just send it to you right before this meeting, so I apologize for that. But I'm happy to run through what those amendments are if you wish. But with that, I'm open to any questions. My client is also on the call should you have any specific questions about Point Click Care.
Can you summarize the amendments, please?
Yes. Bear with me 1 second. So first of all, under the bill as proposed, since we're going back to that, it would be under B2i. So lines 18 and 19 on page 2. That the request is to strike and quote, or another form required by the state designated health information exchange. The rationale for that amendment request is, the release of the records in accordance with the specifications of the Office of the National Coordinator for Health Information Technologies, the ONC. That's already part of the bill, so it would be consistent with practices in other states. I guess we're concerned that another form, basically, as required by CRISP, may not conform with the ONC, which may increase cost for vendors significantly. The other amendment request is to require that CRISP be the access point for patient medical records. This would be consistent with the statute that's relied upon for prohibiting fees to begin with. That's 4302.3H2. And essentially that statute covers healthcare providers, healthcare payers, or CRISP, the state designated health information exchange. It does not include business associates. So that would be our request.
Mr. Castelli.
Yeah, and I'm here representing Real-Time Medical Systems. And so Real-Time Medical System is the company that's been hired by the state to actually conduct a lot of the scanning of medical information. They give real-time intervention to nursing home patients. And this state program really follows from the legislation that was passed back in 2021. So we believe this bill gives certainty to this company that is doing this work on behalf of the state. They've had a lot of success so far in their pilot program. The statewide program has just started. And in the last 2 months, they've had, over a 40% reduction in hospitalizations. So they believe this legislation not only is consistent with what was passed in 2021, but will help them get access to all of the information they need on these electronic medical records in order to provide the clinical information that the nursing home nurses need in order to reduce hospitalizations.
Okay, any questions from any members? Okay, yes, Delegate Cullison.
Thank you, Mr. Chair. I was just wondering if Mr. Castelli could respond specifically to the amendments that have been proposed by Mr. Karkanis.
Yeah, my understanding is that the Maryland Healthcare Commission was very concerned about additional amendments beyond what the original framework of the bill was. So I think that's the concern that we have, that the Maryland Healthcare Commission believes the bill as introduced preserves the intent of that program that was initiated back in 2021, and that original language is the language that is going to help this company continue to perform that work on behalf of the state.
Okay. May I follow up, Mr. Chair?
Certainly.
So let me go, since MHCC was mentioned. Tracy, do you see these sort of ethereal amendments that we have right now detracting from the spirit or intent of the original bill?
Yeah, I'm not sure how to answer that. We're actually trying to confer with our AG to see exactly what our thoughts are around these particular amendments. So if you can give me a moment, I can kind of maybe get back.
Okay, all right, great. Thank you. Thank you, Mr. Chair.
Thank you. Tracy, do you literally mean a moment? I mean, perhaps, well, or during the course of this meeting?
Well, okay, so what I'm hearing is that MHCC would be opposed to the proposed amendments.
Can you
Okay.
say why?
Yeah, why?
Because
Sorry.
Chris would
You should
comply
mute
with the
yourself.
amendments.
Mr. Chair,
Yes, Delegate
are we
Lewis.
supposed to be hearing something, or am I
No,
going
this
down?
is a lawyer-client privilege, I
Oh,
believe.
okay.
I
Okay.
think it was
There's no-
Ben Steffen explaining to Tracy, but I'm not 100% sure what was going on.
Ben is explaining to me. Ben, do you want to just comment? I have him on the phone. He had been called to another meeting, so, but I think you can hear him.
Let's give it a
Just
try.
explain. Okay.
Thank you, members of the committee.
We can
I'm
hear
coming
you.
out of another meeting, but
He can hear you.
okay. We have not looked at these carefully, but we do think that the point of this may be kind of the squabbles between individual contractors, and we would recommend keeping the bill as introduced. The requirement that all transaction sets conform to ONC would seem to me to preclude the possibility that CRISP, which is in the forefront of expanding information exchange for care management and for public health may need to come up with a format that would need to be introduced in Maryland that had not yet been defined nationally. Two, the point of contact through which patient records are transmitted does seem to be innocuous enough, but it doesn't. We need to dig more deeply into that because it could prevent business associates participating with CRISP from making information available through CRISP. So we would oppose both of these last minute amendments as inconsistent with the intent of the original legislation.
Okay, that's helpful.
Thank you. Thank you. Mr. Holt?
Yes, thank you, Chair, and thank you, Subcommittee, for listening to our amendments. Really, what we're trying to accomplish with what we shared with you today is to better understand the what and the how of how this legislation is actually going to work. We believe the level of ambiguity that exists in the language as it reads, as it was originally presented, creates significant concerns on how any of this will be implemented and be a extremely difficult challenge on the regulatory side of things to bridge the gap to actually be able to implement a piece of legislation like this. So that said, our big concerns are the how and better understanding how this would be implemented to where electronic information being transmitted, how that would look.
Thank you. Thank you. I believe the correct is, does anyone wish to offer this new set of amendments? Does any member of the subcommittee wish to offer a new set of this new set of amendments? If so, please raise your digital hand so there's no question about it.
Mr. Chair.
Yes, Delegate Lewis.
Thank you, Mr. Chair. Before deciding whether or not to offer the amendments, is it too much to ask, because there's been a lot of back and forth, what set of amendments would be offered? Can someone just say that, maybe council?
So
Sure.
we don't have an actual amendment drafted. This was an email that I received 10 minutes before the subcommittee started. So, Neil described them. He's probably in a better position to explain it than I am at this point.
Mr. Chair, would it be all right if Mr. Kalkanis could repeat what the amendments are?
Briefly.
Yeah, sure. Thank you, Delegate Lewis, for the question. So essentially, we're talking about two very simple amendments. The first one would strike some of the language on page 2, lines 18 and 19, under B2 little I. We would be asking to strike the words "or another form required by the state designated health information exchange." The rationale is that the words prior to that require the vendor to provide the information through a form created by the ONC. And so Point Click Care, our client, believes that this is consistent with practices in other states, and an alternative form presented by CRISP may increase costs significantly, not just for my client, but for other vendors in this space. The second amendment is really one in concept, so I don't have specific language, unfortunately, but it would require that the state designated health information exchange, in other words, CRISP, would be the access point for patient medical records. In other words, the business associate in this case would be required to access that information directly from CRISP.
I would add, and correct me if I'm wrong, Council, neither of these bills, if passed on third reader by the House, would be final action because they would differ. One would be the House bill, obviously, that's not final action. And then the Senate bill, I think it's fair to say, is likely to be amended with the sponsor's amendment. So there is another option, for consideration of these amendments, one of which is not even before us. Delegate Riley and then Delegate Cullison.
Thank you, Mr. Chair. Can Neil explain, as you heard Tracy from the MHCC, So she, through, Mr. Steffen, said that they would not agree with your amendment, your proposed amendments. Did you understand that? And could you explain why that they would be opposed to that? And if you disagree, can you explain why not?
Well, unfortunately, and this is perhaps the nature of it being late in the game and it being April 3rd and us trying to work this out late in session, but we haven't had an opportunity to meet with MHCC on these specific amendments, so I couldn't speak to their rationale.
Okay. All right. Thank you.
Delegate Cullison.
Thank you, Mr. Chair. Am I correct that there is currently a system by which the electronic health records for each facility is connecting with CRISP, and that the intent of these two cross-file bills is to simply codify that process?
Mr. Castelli.
Yeah, I mean, that was the original 2021 legislation authorizing the sharing of, or requiring nursing homes to share this information. And I think my client, Dr. Scott Rifkin, can talk a little bit more about why that program was created and the purpose for not only improving care, but why this legislation is needed.
Okay, so if and I can save Dr. Rifkin a little time because I think we know why what real time is doing. I think there's been enough conversation about that. My issue is has it been currently, was it happening in 21 and 22 that this information was being shared from different EHRs to CRISP?
So Bill, let me address that. The answer to that is no. CRISP was not able to get the data that we get and use on behalf of CRISP and through CRISP to run this program that drops admissions about 40% of the hospitals. So the goal was to save about $200 million a year under the waiver calculation to maintain the Medicare waiver in Maryland. That everybody knows is at risk because of the parameters of that waiver. So that was the point of this program. It worked successfully in a pilot, and they expanded to the state. The issue is making sure that program will be able to keep getting the data, and that the EMR companies are not going to look at that as a new revenue source to them.
So, but my question goes to what I just heard you say, to make sure that CRISP can continue to get the data. It
Yes.
has been getting the data, but this is way of codifying that the way that it will continue to get the data in the way that it has.
Yeah, they're getting access to the data so we can run the program since January. And let's see what it says. Yeah, since January or thereabouts. But it wasn't 2 years ago. They didn't have access to it.
Okay, but it
So
is.
this bill codifies, I'm sorry.
No, that's so we've seen from January to March the possibilities of this information exchange work.
Yeah.
Okay. Thank you, Mr. Chair.
Thank you. Delegate White.
Yes, thank you, Mr. Chair. My question, following up with what Delegate Cullison raised about ensuring that CRISP continues to receive the data, do we expect any differences in the format or in the manner of which the data is communicated? If this is going to simply codify what is already happening, what are the concerns that exist if this will continue in its current manner? So I just wanted to know, what is it that could potentially look different than what is already happening now?
Would you like me to answer that question?
Yes, please, Dr.
Sure.
Rifkin.
And I heard the beginning of the question and the end of the question. I didn't hear the middle because my connection died. But if I get it wrong, please tell me. We don't anticipate a big change in how we get the data. I think that's sort of just a smokescreen to some extent. We're able to get the data today, and as long as the EMR vendors don't block that data or access to that data, we'll be able to get it. So the idea is to codify our right to get that data.
Yeah.
Mr.
Okay.
Chair, may I follow up?
Certainly.
So if it, again, as it stands, it doesn't seem like anything would change. What I'm trying to understand is the format essentially wouldn't change. There wouldn't be any other ways or fashions that the data would look different, meaning I'm trying to understand what the other concerns there may be from those that have elevated concerns with this bill. What I'm trying to get at, if it's not going to do anything different, what are the true concerns here, especially when it comes to the format or another form in the proposed, I guess, amendment that we have yet to physically see, but have described here?
Yeah, there have been actions by the EMR companies to block access to the data. And I am not a technical person, but they've done several steps, and I'd be happy to get you information on that. But they involve CAPTCHAs and all kinds of other ways to block that data. And we're just trying to make sure that this program will continue to be able to get that data.
Delegate Bhandari.
Yeah, thank you, Mr. Chair. I'm sorry I joined late because of technical issues and I must have missed the conversation. I'm wondering, will some of the amendment address the concern raised by Maryland State Board of Long-Term Care administrators?
I'm sorry, what was your question?
My question is, are these some of the amendment address the issues raised by Maryland State Board of Long-Term Care regarding HB 786? I believe, based on my memory, they were in opposition, stating that releasing the electronic medical records and healthcare transactions of resident to affiliated businesses potentially violates resident control over their medical information and HIPAA laws, something like that. So is there anybody from Maryland State Board of Long-Term Care here?
No, I don't believe so.
Bill, do you want to address that, or would you like me to?
Yeah, I can talk to that if you'd like.
Chair recognizes Mr. Castelli.
Yeah. So we met with the Board of Long-Term Care Administrators, and they clarified to us when we met with them that they had their letter was a letter of concern rather than opposition. And it was regarding making sure that everything was HIPAA compliant. Now, the language that was introduced as an amendment on the Senate was trying to clarify that more specifically, but we used the term consent in that, which gave the Healthcare Commission a lot of concern, because HIPAA is really a notice provision more than a granting, rather than it requiring an actual physical consent of the party. So all of the business associate definition that would also be changed would make it clear that these business associates are operating under all of the federal privacy rules.
Mr. Steffen? Ben, you're muted.
So that's correct. And I think it's important to emphasize that what the Board of Nursing Home Administrators would propose would be to require consent on information exchange that is permitted under HIPAA today. Exchange for treatment, payment, and healthcare operations are permitted disclosures that can occur without patient consent. And we think, I personally think that if this consent requirement had been added, we probably wouldn't have an application, just because of the headaches of trying to get patient consent in all environments, but doubly so in a nursing home situation, where oftentimes patients really aren't capable of making judgments themselves. So these are permitted exchanges that the board wanted to make permitted only through consent, which the Healthcare Commission does not advocate.
Mr. Karkanis, and then we're going to proceed to a vote. You're muted.
Mr.
Okay.
Chair, yep, I'm good. I just wanted to make sure that my client had an opportunity to respond to Delegate White's question, because I think there might be a disagreement.
Mr. Holt?
Great. Thank you, Chairman. And I think what we've talked about in this last portion is the point of contention in this proposed legislation. Point click care, we are stewards of the skilled nursing facilities data. We do with it as we are asked. We share it with CRISP already. And this goes beyond codifying what already exists in the transfer of that information to the state designated HIE. As we continue to talk through this, the how and the what's that we're discussing now highlight how vague this legislation is and what it's actually trying to accomplish. I believe any sort of accusations of information blocking go beyond this subcommittee. There are federal channels through which those complaints are designed to be made, and none of those have been made to this point. And frankly, that is no way to operate or run a business. And so as we're trying to understand what this is trying to accomplish, that's how we're trying to be good partners, both to this subcommittee and the state of Maryland.
Mr. Stefan, is your hand still up?
No, I want to take it down.
Okay. Delegate Hutchinson.
Thank you, Mr. Chair. You know, we've gone round and round about with this issue, obviously for many weeks here. And every time I keep hearing this, I hear a dispute between two companies. And we're now legislating a dispute between two companies. And what is perplexing me is that I believe that we already have existing laws in place that say that the data should be passed over to the other vendor. And the end result here is we're getting improved quality care in our long-term care facilities as a result of this. And I just keep thinking that we're sitting here legislating a dispute between two companies. And my personal opinion is that we shouldn't be here, but we are. And I think we're about to vote to make sure that this continues, that the data can be passed appropriately to the provider that's providing the service for our long-term care facilities. Thank you.
Thank you. Okay, I believe what is appropriate now is, are there any amendments that any member of the committee wishes to offer to the bill? I do not see anyone who wishes to offer. Delegate Cullison, Delegate Bagnall. You may be speaking now to the Rosapep amendments.
Correct,
not.
sir. I would ask that
That clarifies.
we amend the Senate bill to strike out the Senate amendments and return it to and conform it with the original House bill.
Second.
Okay, so we will take up the Senate bill first in light of that well-made pooling. Any objection to those amendments? Okay, any other amendments to be offered to the Senate bill?
So just so everyone is aware, there is a technical amendment.
Oh, thank you. Thank you,
that needs
Kim.
to be added to both of the bills. And it is just changing a cross-reference on the House bill. It would be page 1, line 21. I'm not sure the Senate bill, but we're just, I can make sure that both of those are in there, but just so you know, there needs to be an amendment to the Senate, or to the House bill, and also one additional tweak to the Senate bill.
Mr. Chairman, can we go ahead and move that amendment that Lisa was just talking about?
Certainly. There is no objection to that amendment. Okay, so we've now accepted two sets. We've accepted the Rosapep amendments to the Senate bill, which would conform it to the House bill as introduced. And we have accepted the amendment, the technical amendment that council has informed us is necessary. Delegate Bhandari.
Yeah, I just wanted to move the amendment, that's all.
Which amendment?
The amendment proposed by Delegate Collison.
Okay, so that's already been done.
Okay.
So just so everyone is clear and there's no misunderstanding, we have been working on the Senate bill and we have adopted the amendments proffered by the Senate sponsor, which would strip from the Senate bill the amendments that were added to that bill. And we have adopted the technical amendment that council has asked us to adopt. There are no other amendments being offered that the chair sees to the Senate bill. I will now, is there a motion on the Senate bill as amended?
Move the bill as amended.
Move the
Second.
bill as amended. All those in favor say aye.
Aye.
Is there anyone opposed to the Senate bill as amended? Okay. We now have before us the House bill. And we should formally, will someone, oh no, we
Can
need
we
to
move-
offer the technical amendment.
Can we move the technical amendment?
Technical amendment as proffered by
Second.
council is moved and seconded. No objection. Is there a motion on the bill as amended?
Move the bill as amended.
Second.
Thank you. Bill is amended. All those in favor say aye.
Aye.
All those opposed? Okay, so the two bills have passed in identical form. We now will move to social work licensing. The first bill we'll take up is Senate Bill 145. Council?
So Senate Bill 145 is the cross-file to House Bill 103, which we passed earlier this session. House Bill 103 authorizes the board to issue a temporary license if the national exam is not available for 15 business days. Senate Bill 145, as amended in the Senate, included that temporary license because that a conditional license, and then also would provide for a temporary license would authorize the board to issue temporary license for applicants who have met all of the requirements for licensure except for passing the exam. There are some amendments that were distributed, and the amendments would conform Senate Bill 145 to 103, with the exception of retaining the new title of conditional license.
And I can't put my hand up, Mr. Chairman. I apologize because I'm in the car. This is Chairman Pena Melnick.
We will waive the rule for you, Madam Chair.
I appreciate you so much. Otherwise, I will be on video, but I'm in the car and
No problem.
hands-free for the record. I just want to ask the subcommittee to consider the amendment that the council just described. After we heard these bills were heavily amended after we have worked so hard, in the House, and I want to thank this committee for doing that work. And basically, in the Senate, they were, stripped as well. We were not part of that discussion then. I have spoken with the wonderful Chairwoman Griffin, who said that they amended it, but she will be open to our input as well now. So this is the input that you have in front of you. I would like Delegate Collison to address you and tell you how we came about it. I put together a small group of diverse people from the committee that actually came up with this solution. I really think it's the right one for a very difficult and challenging issue, and it will really help. So I would like Delegate Collison, if it's okay with you, Mr. Chairman, to address the subcommittee. I also want to thank Lisa Simpson and the rest of the committee for your hard work.
Thank you, Madam Chair. We certainly will defer to your request that we recognize Delegate Collison, the Vice Chair of the full committee.
Thank you very much, Mr. Chair. So I wanted to make sure that folks understood the rationale behind the amendments that you have before you. In House Bill 145, we're recommending leaving the concept of a conditional license because in the event that the test becomes unavailable within the current scheme of and process by which you gain licensure, then we think that we have to have that tool in the toolbox in order to make sure that people can practice until the test becomes available. That's a bill that we've been working on for 3 years, and we passed it this year and feel like we need to make sure that we can preserve that. With respect to the addition to the Senate additions of the term temporary license, we're recommending removing that language now out of this bill. And it was, and we understand completely what the intent of that language is. It's really to allow applicants to not take the culturally biased national exam. We get that. There was lots of conversation. We have the report, raising questions about the exam. But as long as the language is that the board may grant a license without passing the test, and if there is no strict standards by which the board would grant that temporary license, it is our suspicion that no temporary licenses would be granted. But to get to the compelling issue, we put an 871. That's right? 871, or is it 817? Yes. Yeah. A timeline for the work group to come back with a recommendation about the exam, December 1, 2023, this year, so that we would be prepared to make a decision about that, whether or not the exam should be used, and if so, then if that's what the group is recommending, what would it recommend how the exam might be used? Currently, the exam has complete veto power over all the training and experience that applicants have. So I am feeling confident that the work group will look at that and see what a more appropriate measure might be. But we want to give folks the time to have that conversation so that we know what would be and make an informed decision about this process, because it's a major change in the process. That's speaking to 145. If I might, Mr. Chair, just say, in 817, we dealt with a lot of the
871, don't you?
871, right? 871.
That's okay.
Reversing those numbers. We dealt with the issues that were identified in the hearing. And there were a number of them, by clearly delineating what the work group had to work on and come back with recommendations about. And they have a longer period of time to do that. So that's how we thought we could address the numerous issues that were raised during the hearing. So, Mr. Chair, I'm open to questions, or the council has information as well. So thank you very much for the opportunity.
If I may, to clarify, you are the chair of the work group that the full committee chair asked to review these bills to make a recommendation to this subcommittee, correct?
Yes. Yes.
Thank you. Thank you. Ms. Doyle, followed by Mr. Boston.
Thank you. Hello. I guess my concern here is that we know this exam is causing harm right now. And so if we are removing a temporary pause, it's not permanent even, it's a temporary pause, we're allowing active harm to continue right now while we try and figure out a solution. And those of us advocating for removal, we have given compromise after compromise, and it's never been good enough. And I represent a group of over 300 social workers and allies who we need a change. This exam at all levels is actively harming Maryland social workers, and is actively harming Marylanders. So by removing the temporary licensure, we're reinstating a known harm, and I really object to that. Thank you.
Mr. Boston.
Yeah, good afternoon, Mr. Chair and members of the subcommittee. I am here on behalf of Presley Ridge. We were extremely active in the shaping and making of House Bill 140, Senate Bill 145 and the companion House Bill. We support the work of the subcommittee as explained by Delegate Cullison, and we thank you for that. We realize that, you know, the exam has its issues and regarding cultural biases, et cetera. But I think as Delegate Cullison has explained through the work group that's going to be in 871, they're going to indefinitely study the issue. So on 145, as amended, or I should say, as suggested by the committee and the work group on the amendments that you're putting on, my group, my coalition, who has worked intensely with Delegate Bagnall and the subcommittee and others on this bill, we support the work and we support your proposed amendments.
Mr. Massey?
Thank you. Hope you can hear me. I'm speaking from a classroom. I'm at work today. So just want to echo what Rachel Doyle said and add a few things. I think what I'm hearing is contradictory. On one hand, you're saying these exams are biased, are causing harm. And on the other hand, you're saying, wait, let's not do anything to address that. The evidence is there. The evidence is overwhelming of the harm this is causing, not only to the social workers that are trying to take this test and well prepared to do work, but also to Maryland, who's lost out on thousands of good social workers. These amendments don't address the workforce shortages that are in Maryland, and they don't allow good social workers to go to work who have been harmed over many years. So there is a way to deal with this. We can offer temporary 2-year licenses right now and put that work group to work to make a more permanent solution. That was in the bill on Thursday. We would like to see it remain in the bill. Thank you.
Delegate Cullison.
Yes, I would just like to, thank you, Mr. Chair. I'd just like to respond to some of the concerns that have been raised. I don't disagree that this is prolonging the procedure a little bit by a year. But what I would offer is that if the board does not have at its fingertips the way to make decisions about how to grant a temporary license, we are running the risk of some people getting temporary licenses and some people not getting temporary licenses, and they will have nothing to base those decisions on. If the work group does its work, which I fully believe that it will, given who is on the work group, and there is great, I think, good representation of social workers on the work group, then the work group will allow us to come up with the standards.
Whoever is
by which
talking,
those
please
decisions-
mute yourself.
So-
I'm sorry, Delegate Cullison.
Thank you, Mr. Chair. I appreciate it. So that's why we need this sort of informed decision-making process in order to make this work. Thank you, Mr. Chair.
Thank you. Mr. Doyle, followed by Ms. McClellan and Mr. Snyder.
Yes, thank you, Will Doyle. Yeah, I just wanted to clarify that the bill for temporary licensure was actually originally SB 872 in the Senate, and it did include shall. And if that language was there, then we could actually ensure that that intent was there. Yeah, there's no certainty about what will happen in a work group, and we know some stated positions of certain members of the work group who don't want to replace the exam. So there's a significant risk that not only this known harm will continue during this time, but the no harm will continue to remain in place after the work group is even finished its work.
Ms. McClellan.
Good afternoon. I'm Daphne McClellan, the Executive Director of the Board of Social Work Examiners. We support the work of the subcommittee, and we are in favor of the amendments as they have been suggested. We understand the word conditional to mean that it's conditional that the exam is not available, not conditional that the person be supervised, because all LBSWs and LMSWs have to be supervised anyway. So yes, thank you for the amendments, and we are in support.
Mr. Schneider, followed by the chair.
Thank you. I guess my real question is whether there's anybody who thinks that this exam assesses competency or accountability or safety. Because if they do think that, then they have to think that Black folk are not as competent or as safe or as accountable, that non-native English speakers are less competent and safe and accountable, that people who have disabilities, people who are non-native English speakers. And that just strikes me as absurd and offensive. But that's what the exam says. I mean, and that's what this is about, it seems to me, most importantly. I appreciate all the work that's been done over multiple years on Senate Bill 841 or 845. I guess one alternative then would be to amend 871 to stop the requirement, not to stop the offering, but to stop the requirement of the licensing exam as part of what's necessary, that that the moratorium, you all could put the moratorium back into 871. That's what I would encourage if to move this forward and stop the harm that's being caused.
Delegate Peña-Melnick, Chair Peña-Melnick.
Yeah, Lisa, will you please go through what the work group is going to do and the timeline, and then, Mr. Chairman, I would like to be heard.
So Senate Bill 871, there were amendments distributed, and what the amendments, the study part of the amendments are requiring that by December 1st, 2023, that the work group would come back and would give us a recommendation on whether to continue using the national exam and whether the state should issue temporary licenses to applicants who complete all of the licensure requirements, except for the exam. So that requirement would come back to us by December 1st, 2023. We would have that information for next session. And then by December 1st, 2024, so in a year later, the work group would examine all of the licenses issued by the board, would look at whether any of the other requirements also establish or are biased, and look just at the efficiency and everything, and would get back to us by December 1st, 2024, and make recommendations to eliminate bias and make the process for licensing social workers in the state more fair, diverse, and efficient.
And who's the composition of the, just for the record, of this work group? Who's on this work group?
Lisa? The composition?
Just trying to find it.
It's on page 6 of 8.
Okay, so there is a member of the Senate, a member of the House, the Secretary of Health or the Secretary's designee, the Secretary of Human Services or the Secretary's designee, the Chair of the State Board of Social Work Examiners, the Chair of the Maryland Commission on Health Equity. With our amendments, we were adding in the Executive Director of the Board of Social Work, the Executive Director of the Board of Social Work Examiners, and a member of the Governor's Office of Deaf and Hard of Hearing. There is also a representative of the Baltimore Legacy chapter of the Association of Black Social Workers, a representative of the Maryland chapter of the National Association of Social Workers, member from the Greater Washington Society for Clinical Social Workers, 2 representatives of the Association of Social Work Boards, and then the following members appointed by the governor, 3 deans of social work from accredited social work master's programs, 3 representatives from non-governmental social service organizations that primarily work to support Western Maryland, Central Maryland, and the Eastern Shore. And 2 individuals who received a master's degree in social work within the preceding 10 years and who have been negatively impacted by the exam, a representative of Gallaudet University. Those were the members.
I would like to, if I may, I know I didn't discuss this with you, but I would like to change the composition of the delegate in the Senate to a member of the Black Caucus from the Senate, a member from the Black Caucus from the House. Because this is a priority of the Black Caucus. And also, I like to add the NAACP to this, please. And I want to let you know that I hear you. I know it's a problem. I'm a person of color myself who had to take the bar many times, more than I care for. And I know that it did not indicate whether I was going to be a good lawyer or not, or a good legislator, because obviously, in a very humble way, I am, and I work very hard. But English is my second language, so I get it. I want to let you know that I'm very committed. But given the fact that we only have a week left, where things will die if we don't get something done in order to get as much consensus as we can. You know, December is only 7 months away. All right, 7 months. They'll come back with recommendations. We will act on it. You have my word. I'm committed to finding a solution for this in the next session with the report that we can justify it. I added the NAACP and the members of the Black Caucus because I know that this is a priority for us. So I need you to trust me on this. We're very committed to it. Thank you.
We very much obviously appreciate your input, Madam Chair. A suggestion? I believe that on House Bill 812 on reproductive health care, we called for interim reports, before actual completion.
Essentially, we are asking for we're asking them to come back to us before next session with the answer to the two big questions, and then they have another year after that to give us the other information. So it's.
Well, I guess I understand that, and I appreciate that input. Whether a 3-month report would be worthwhile, or whether that would be premature, or on the other hand, is that a way of saying how important that is to the General Assembly, that we want indications that this is being done in a very serious way? It's up to the subcommittee. Okay.
Does not hurt because, it indicates we are serious about this. We expect it.
I can't hear you well, Madam Chair.
Can you hear me now?
Hear you better, yeah. Yes.
Yes, I think it does not hurt to put that in, especially because it indicates that we're serious about it, like we are about everything else. We always are, but that this is really important. So I would say we could have an interim, 3 months before. That would be good.
Thank you.
September 1.
When is the effective date of the?
It's an
emergency.
Okay. And then it's also something that we can, without putting language in the bill, to impress upon the governor's appointments office the essential nature of getting this group started yesterday. I know we can commit to that. Okay, Mr. Massey, Mr. Boston, Ms. Ross.
Thank you. Yeah, I just want to respond to what Delegate Cullison had said, and just respectfully disagree on a couple of things. First of all, there's one easy solution, to leaving it up to the discretion of the board. And that is a simple change of one word, changing the may back to shall, which was in the original bills to begin with. We also agree that we shouldn't be giving the board discretion on these temporary and conditional licensing decisions because they've clearly shown that they have no interest in addressing the problem, and they have a vested interest and connection to ASWB, who manufactures and makes a lot of money from the exams. I would also suggest that there are very clear requirements that serve as a perfectly fine baseline to enter practice without the exams. Not everyone gets a master's in social work from an accredited institution. Not everyone has hundreds of hours of field work to complete supervised. Not everyone can enter the practice and then have to go under thousands of hours of supervision to make sure they're doing good practice. So I don't think it's an unclear baseline without the exam. We've seen many other states that already don't even use the master's and bachelor's level exams at all, with no harm to the public. The evidence, again, is very clear. Now, if you don't want to change the may to shall, I would support Mr. Schneider's suggestion to bring back the moratorium to Senate Bill 871 and do away with the exam requirements for folks, because as you all have continued to say, we know the harm. So why are we continuing the harm?
Thank you, Mr. Boston.
Yes, just a little history here. Speaking on Senate Bill 145, it is the bill that was introduced over and over again for the past 2 or 3 years. On Senate Bill 145, which has as indicated by the number, it was well introduced way before 871 and 872 came about. There, I agree. Initially, we wanted the word shall, but understanding the legislative collaborative process and working together with all of the parties involved, we realized we were not going to get the word shall. So it's about taking the first step forward first. And in doing so, all of the parties came together, the School of Social Work, the National Association of Social Workers, the Maryland Board of Social Work with Daphne McClellan, and many other members of the private sector who are part of a coalition I represent, came to a very hard-fought consensus on this bill, with the exception of the word conditional replacing the word temporary. And to Mr. Massey's point about, you know, whether the board's going to do anything, there are reporting requirements that are in this bill that comes back to this very same committee and subcommittee and the Senate companion committee, in which they will review what, if anything, the board did in this space. And the board will have a chance to explain what, if anything, they did in this space. But the bill as amended, as explained by Delegate Cullison and the chair of this committee, Delegate Chairwoman Payne Milne, is the collaboration of a compromise that is the first step. I think the work group, as represented by 871, will address all of the other issues that have to do with the biases of the test. You know, we want to see something done, and I think this is the best way to get done what we have, you know, collectively agreed upon.
Thank you, Mr. Boston. Ms. Ross, followed by Delegate Cullison. We can't hear you, Ms. Ross. You don't appear to be muted.
I'm not. It was my
Okay.
headset. Can you hear me now?
Yes, ma'am.
Okay, great. Good afternoon, everyone. I want to specifically thank Mr. Boston and Delegate Bagnall. I know that 3 years is a long time to be doing this work. I think 3 years ago, I was still in my master's program, so I had no clue that some of this existed. And now that I am present, I am very grateful to understand the legislative process better, but I'll speed this along. Specifically, I also represent the 300 advocates from social work in partnership with some of my colleagues that you heard from earlier. As someone who is being actively harmed right now in both my pockets and trying to get to the clinical space, this is a situation that is very near and dear to my heart. And I think my community members who I serve would also kind of rile up in here and say that they're ready for me to have my full clinical licensure as well, since I've done all the work outside of passing the exam. Specifically for 871, I want to make sure that we aren't missing out on our deaf and hard of hearing colleagues. While I appreciate that Gallaudet is mentioned, specifically Gallaudet is a very large institution, and I think the deaf and hard of hearing advocates that we work with would really appreciate if it was more specific to the School of Social Work. That would just be one thing that I would like to point out. In addition to that, I definitely hear where everybody else is coming from. I think I'm just as angry, but representing how I represent, that doesn't always get to be shown. And it doesn't get to be spoken up about. I think my question was answered. I was wondering where the board fits in with this, in addition to like what they have to report to the subcommittee. And I think that got answered. So if I'm understanding correctly, they would have to show their findings of how they were, I guess, where they were in this process as well. Did I have that correct?
Who can answer that?
The deaf and hard of hearing? I'm sorry, I was
No,
distracted.
the deaf and hard of hearing specific language. I wanted to point that out because we have advocates that have not been able to join us because either they can't get captions or they haven't been able to get an interpreter present. So I wanted to make sure that I advocated for them in this space, specifically with the
I
871.
appreciate that.
Absolutely. And in addition to the board, what I'm understanding is that they do have to report their findings to you. I know that I brought up a very specific issue regarding my experience, and my experience is not unique. With some of us having to, in order to make a livable wage, we do have to take up on positions that don't actively have an LCSW on staff. So therefore we end up paying for supervision. And so I was wondering if there was anything, I know 871 speaks to all findings. I wonder if that was a part of all findings that the board was also going to be held accountable to.
If I may, Mr. Chair, yes,
Certainly.
Absolutely. That was one of the things we discussed in these amendments.
Thank you
That
so
was very
much.
troublesome to us.
It's very
Right.
troublesome for my pocket, so thank you very
Right.
much.
Right. Mr. Chair, I hate to point out, but we have 5 minutes before the bells ring. I guess what I would like to do is move the amendments for SB 145.
The amendments for SB 145.
Second. And those amendments would conform it to Delegate Bagnall's House Bill 103 with one, not a matter of nomenclature, except for nomenclature.
Yes, sir.
Correct?
Yes.
Okay. All those in favor, please say aye. Those amendments?
Aye.
All those opposed? Is there a motion on Senate Bill 145 as amended?
Move the bill as amended.
All those in favor, say aye.
Aye.
Is
Delegate Cullison, you
anyone-
might want to lower your hand.
Oh, sorry.
Yeah, and Delegate Boston, could you lower your hand as well, please? Thank you.
Delegate Boston got a promotion.
He's inherited a seat. All those opposed to Senate Bill 145 as amended? Is there anyone opposed to 145 as amended? Seeing none, the bill moves forward as amended. Delegate
Now-
Cullison, do you have any further motions?
I do. I would like the subcommittee to consider amending in the subcommittee itself on page 6 of 8, where it's in line 4, where it says one member of the Senate of Maryland appointed by the President of the Senate. So it's one member of the Senate Black Legislative Caucus appointed by the President. And Lisa, you'll clean up that language for me. And in line 6, one member of the House Black Legislative Caucus appointed by the Speaker. And
The
And then I would,
NAACP.
right, I would ask that
I'm sorry.
I would ask that we add a member of the NAACP to the work group. And I have to find the line for the, here we go.
Well,
I would like to add in line 5 on page 7 of 8, one representative of Gallaudet University from the School of Social Work. And then the NAACP, and then suggest that we ask for an interim report regarding the primary issues of the exam and the temporary license on September 1, 2023.
Are there any questions?
Yes, this is.
Yes, go ahead,
Chairman
Madam Chair.
I thank you, Vice Chair Collison, for that. I like to add to that interim report, the fees paid for supervision. I want a report on that in 3 months.
Okay. I would consider that a friendly amendment to my amendments.
Thank you.
If I may, I just wanted to read in the chat, the deaf community is actually requesting somebody who is deaf. Someone from Gallaudet University doesn't ensure that it's somebody who is deaf. The language they have requested is a social worker designated by the Maryland Association of the Deaf, who is familiar with the licensing process for deaf and hard of hearing social workers. It's in the chat.
Is that acceptable, Delegate Collison, as the maker of the motion?
It is, Mr. Chair, I could accept that.
Okay. Are there any questions from the members of the subcommittee?
So I just have a quick question, just for
Sure.
clarification. Is that in addition to the member from Gallaudet, or is that in place of the
There are
member?
there are two representatives. One is a a member of the deaf and hard of hearing community. Oh, it's the governor's office from the deaf of hard of hearing. So I would be, since the governor's office is represented, I think if we went with the language suggested by Maria, social worker designated by the American Association of Deaf, I think that would meet the need that we were trying to address with the person from Gallaudet. Okay.
Yeah, because it was a representative of Gallaudet, so it'd be one for one.
Right.
Okay. So, correct me if I'm wrong, Delegate Collison, but this is an amendment to your amendment or a separate amendment?
That's I'm accepting that as a friendly amendment to my amendments.
Okay. Is there any objection from members of the committee, subcommittee? There is none. Is there a motion on the bill as amended?
Mr. Chair, I think we need to move the amendments that were offered by when we in the reprint as well.
Okay, sorry. I thought we were taking them all.
Yeah.
Fine, no problem.
I'll move those amendments.
Second.
There is no objection. Chair sees no objection. And now is there a motion on the bill as it has been amended?
Move the bill as amended.
Second.
No further discussion. All those in favor of the bill as amended, please say aye.
Aye.
Anyone opposed? There is no one opposed. That bill moves forward as amended for consideration by the full committee. That completes, I believe, council, just under the bell, the work. Yep. Closing remarks from Chairman Pena-Melnick.
I just want to thank everyone for your work. I know that you probably, some of you feel that you didn't get what is right and fair, but given that we have 1 week exactly left in the session and that we have to get this through this week and go back to the Senate, and we're going to end up now in conference committee because they're not alike, right? It is imperative that these bills move through and that, you know, we let it go and do our best to try to find a solution. And I want to thank everyone, because otherwise what's going to happen is that there's no bill. And then that means we come again next year. And that's a shame, because so much work has been done. So I want to let you know that you're heard. You can see all the work and the struggles in trying to, you know, be, you know, flexible and considerate. So I know my word is my bond. I look forward to receiving those reports and acting on it as soon as we can. So thank you very much. Thank you very much to everyone for your hard work. You have a blessed day.
Thank you. Ms. Bramble, we need to adjourn in order to get over to the House floor. So I'm going to adjourn this meeting, and this bill will be before the full committee at its next voting session, and then presumably, hopefully, on the House floor. Thank you all very much. We are adjourned.